Hello, I'm Jordan. I'm going to be doing my health assessment video today. I'm going to go ahead and scan the room, make sure that I'm not cheating. Can you see everything? Here's my winter wonderland. I'm going to say this for the 5th time today, that I handcrafted all of those snowflakes myself. And my house is a mess. So here we go. So, first thing I would do is I'm going to check the chart, provide for privacy. Yeah, that's right. And I would wash my hands and identify the patient using 2 different identifiers. Can you please tell me your name and date of birth, please?
Olivia Skaggs, 3294,
Awesome. Can you tell me where you are?
with the Winter Wonderland,
Yes, that is correct. And do you know what today is?
November 30th.
Awesome. So patient is oriented times through 2. Anyways, she has she's orientated. She's ONA times 3. She is does seem to have proper facial expressions. She's wearing proper clothes. I did ask her to remove some articles so we could get that skin-on-skin contact. So first thing I want to do here is would like for you to tell me, have you had any head trauma?
No.
Do you have any dizziness or headaches?
No.
Okay. So what I'm going to do is I'm going to put some gloves on. We're going to do a head-to-toe assessment today, okay?
Okay.
I'm going to put my gloves on, and I'm going to palpate her scalp. I want you to tell me if you have any tenderness or any lumps or anything when I palpate.
Okay.
Okay. I would like to note that the hair is dry and clean. Her nails look appropriately taken care of. Her clothes are good. She doesn't have any bad odor or anything like that. Her hair is not overly dry or overly oily. It's pretty good. It's shiny. It's not brittle or breaking. It looks nice and healthy. She noted no pain during palpation. So that tells me that she has a head that is atraumatic and normocephalic. So next we're going to go to your sinuses. I'm going to palpate your frontal and your maxillary. I'm going to push down. You're going to have some pressure. But I want you to tell me if you have any pain.
Okay.
Okay, so I put my new gloves on because I just touched my face. Any pain?
Nope.
Okay, good. Throwing my gloves off, putting new ones on. Okay, so I do want to say that her eyebrows are properly, the hair is properly disputed on her eyebrows and her eyelashes. They're not dry or overly oily. There's no lesions or anything on her eyes. Have you had any difficulty seeing lately?
No.
Any blurriness, anything like that? So cranial nerve 2 is intact. Have you had any issues smelling?
No.
Okay, so if I was able to, I would give her a smell test, but I'm not, so we're going to say that cranial nerve 1 is intact. Have you had any eye infections,
No.
drainage,
Nope.
crusties when you wake up in the morning?
Yeah.
Yeah. Okay, like really badly, like you can't open your eye, or just like here?
No, just like in the corner.
Okay. Do you have any nasal drainage?
No.
Any like any lesions in your mouth?
No.
Okay. Any problems with your teeth, cavities?
I do have cavities.
You do have cavities. When's the last time you've been to the dentist?
It's been a couple months.
Okay. Do you usually go every 6 months?
Yes.
Okay. And how do you care for your teeth?
I usually brush them twice a day.
Okay, good. Any drainage or infection in your ears?
No.
Like itchiness?
Nope.
Trouble hearing?
Mm-mm.
Okay, awesome. So, first thing I want to do here, or next thing I want to do, is I want to have you look over there at that beautiful tree
Okay.
that my son and I decorated. And when I ask you to, I want you to focus in on the pen. All right, go ahead. Okay, there was proper accommodation. I'm going to have you follow the pen with just your eyes. Don't move your head.
Okay.
Okay, good. I'm going to ask you to look forward. I'm going to shine this light in your eyes 2 times on both sides.
Okay.
And I'm going to be looking for that consensual and direct reflex. So, there's our consensual, or direct, there's our consensual. Okay, direct and consensual. Okay, so that tells me that cranial nerves 3, 4, and 6 are intact. I'm going to go ahead and check your conjunctiva. I'm going to pull down your eyes right here. Okay? So I'd like to note that the conjunctiva is wet and moist and pink. Wet and moist are the same thing. It's moist and pink, and that the sclera is white. There's no lesions on the nose. The nose is symmetrical. The nares are both the same. The eyes are symmetrical. Pupils are round, equal, reactive to light. All of that. I'm going to have you look up. I'm going to take a look in your nose. Okay, so it is moist in there. Proper hair distribution. The nasal is midline. I'm sorry, the septum is midline. I'm going to have you put one finger over your nose. I want you to breathe in and out. You have any trouble breathing? Okay, and on the other side? Any difficult breathing? Perfect. I'm going to have you open your mouth for me, please. Stick your tongue out and say ah. Okay. All right, go ahead and close your mouth. The uvula is midline. The hard palate did retract when she said ah. The mouth is moist and pink. There's no lesions or anything like that. I did notice a couple fillings from the cavities. Her lips are moist. They're not dry or cracking or anything like that, and they're pink. The teeth seem to be clear, and there wasn't like an extreme bad odor when she opened her mouth or anything like that. Can you stick your tongue out for me and lift it up and down and side to side? Can you say light, tight, dynamite?
Light, tight, dynamite.
Okay. Cranial nerves 9, 10, and 12 are intact. Normally we would test the gag reflex for number 9, but we're not going to get that in depth or invasive with this particular video. So next thing we're going to do is I'm going to test for cranial nerve 5, and I'm going to look for, I want you to tell me if this is a dull or if this is sharp. So go ahead and close your eyes. I'm going to poke in 3 places. I want you to tell me what it is.
Dull.
Okay.
Sharp.
Perfect. And I'm going to try it on your feet. You can do it across your legs. Okay, close your eyes.
Sharp.
Okay.
Dull.
Okay, good. So, the next thing we're going to do is I'm going to have you puff up your cheeks, smile, raise your eyebrows. Perfect. So tell me cranial nerve 7 is intact. I'm going to place my fingers right here on your jaw. I want you to open and close for me, okay? Okay, any pain? Anything like that? Okay, there was no cracking or anything like that. So cranial, that again pertains to cranial nerve 5. I'm going to go ahead and take a look at your ears here. I would just like to know that in the eyes I would normally use an ophthalmoscope, and I'd be checking the fundus, and I want to make sure it's that creamy, like pink, yellowy tinge. I forgot to mention that. And with the ear, I would use an otoscope, and I would look in the ear, and I'd be looking for that pearly white tympanic membrane. So what I'm going to do is I'm going to pull up on your pinna, I'm going to push on your tragus, and push on your mastoid process. Any problems, anything with that?
No.
Okay. And her ears do look symmetrical. Okay. I would normally do it on both sides, but today we're not going to do that just for the sake of the video and the time frame. Ears are symmetrical. There's no lesions. They align up with the side of the eye, so that tells me that they're in the appropriate place. And we've already asked if she has any problems or anything like that. So I'm going to go ahead and palpate your lymph nodes. I want you to tell me if you have any of them that are feeling tender or anything like that, okay?
Okay.
So here's the preauricle. Here's the postauricle. The occipital. Superior cervical. It's right there at the top of that muscle. The juguleodigastric or the tonsillar. The submandible. Submental. I'm going to do the supraclavicle. I'm going to do the posterior cervical. I'm going to have you tilt your head down into that side, please, for me. Okay, this relaxes the muscle, so I'm able to get in there to that deep cervical chain and see if there's any inflamed on that side. There's not. And again to this side, down and over. Okay, perfect. There is no issues there. I'm going to test the skin turgor, or some would say tugar, and there is no tenting. So I'm going to ask you to step forward for me, please. And if you could, spin around that way. We're going to do the whisper test. I'm going to say 2 words on each side of your head, and I want you to tell me with your eyes closed, repeat the words back to me, okay?
Okay.
Apple.
Apple.
8.
8. Peanut butter. 11.
Okay, good. And we're going to go ahead and palpate the thyroid while we're back here. So if you could, put your head down and to the right. And we got to get in there and pull this muscle back so we can get in there. And you don't really want to be able to palpate it. And I don't feel anything. Am I hurting you? Are you okay?
Mm-hmm.
Okay. Okay, so the thyroid is good. So go ahead and lay back down for me. I'd like to note that the trachea is midline. I'm going to have you look up and swallow for me. Okay, so everything seems to be midline. There was no protruding nodules or anything like that. Coloration is perfect. There's no discoloration or anything like that. So push down on your shoulders. I want you to shrug up. Okay, good. So cranial nerve 11 is intact. I'm going to put my index finger here. I'd like you to put your index finger on your nose. Touch my finger in your nose. Perfect. And if you could, please run your heel down your tibia. And on the other side as well. Okay. So as far as neurological goes, she's able to follow command. So now what I'm going to do is I'm going to test for any nodulars or crepitus in your chest area. So I'm going to push on there. If you have any issues, I want you to tell me, okay? I'm going to go into the axilla because it could even go into there. And I'm just running my hands over the chest. I think it's a little bit difficult to see, so I'm going to explain it. Just kind of going like this motion, trying to find any tenderness, nodules, or that Rice Krispie feeling, and I did not feel it. So if you could just slide your butt up so you're sitting up a little bit more for me so they can see. Thank you. Perfect. Okay. So I would just like to say that the stomach, or the chest and the stomach do seem symmetrical right now. She doesn't have any labored breathing. The skin is warm and dry to touch on all extremities. See on here. There is proper hair distribution. I'm going to check the pitting. There's no edema on her legs. Not at all. So that's good. So now what I'm going to do is I'm going to percuss. And where I'm going to percuss is I'm going to find the top of the sternum. And I'm going to come down here to the angle of Louis. And that's going to give me the second, if I can find it. Right there. That's going to give me the second rib. And I'm going to go down to that middle, to that intercostal space. And that's where I'm going to start my percussions. I'm going to percuss on both sides. And I'm going to work my way down to the 5th intercostal area. So, okay. And we're listening for that hyper-resonant sound. Or that resonant sound, not hyper-resonant, because hyper-resonant, it would be a disease. And you have to be careful around the breast tissue because that can give you a dullness. Try to let me know if this is painful for you at all. If you could, please lift up your shirt. Just going to kind of percuss down here a little bit. Good. And you might get a little bit of dullness down here towards the bottom because you're going to start coming over some of the organs, like the liver and the other stomach, the visceral organs over there. Okay, good. You can lower it. So I'm basically going to auscultate in the same areas that I percussed. So again, I'm going to find my top of the sternum. I'm going to come down here. I'm going to go on both sides all the way down. But when I come down here, I'm going to come around to the sides a little bit more. About the 5th intercostal muscle, or intercostal area. So every time, if you could, if I move, when I move my stethoscope, if you could take a deep breath in. If you could lift up your shirt for me, please. Thank you. Okay, good. So there were no adventitious sounds. Again, her breasts were unlabored, and they seem to be symmetrical. So what I'm going to do, I'm going to have you turn your legs over here. I'm just going to have to climb on the bed, but it'll be fine. Okay. So, first thing I want to do is I'm going to find my areas where I'm going to use to mark my findings. So I'm going to start up here at the bottom of the neck, at the top of the thoracic cavity at C7 or T1, kind of differs for everybody. And we want to go on both sides. This is going to be the apex of the lungs. So we're going to walk down between the intercostal muscles. I'm going to have her pull her arm back so I can find the bottom of the spinous, the scapula. I believe it's the spinous process. And that's going to give me about T7, T8. And from there I want to walk down to 10, and that would be the base of the lungs. And if I wanted to, I could walk down 2 more to T12, and that would give me the base of the lungs on inspiration. And from T10, I'm going to walk around to the side, and that's going to put me at T8. I'm going to walk up to T6, and I'm going to listen in all of those areas, and I'm going to percuss in all of those areas. But before we begin that, I'm going to do the tactile fermentus. So I'm going to place my hands on her back, and I'm going to have her say 99. And what I'm expecting to find, is that vibration from the vocal cords diminishes as we go down. So go ahead.
99, 99, 99, 99.
Okay, good. And it did. So now we're going to start the percussion. And again, I'm going to go up here to the T1, C7. And again, I'm listening for that resonant sound. Kind of just go down. We want to make sure that we don't get over the bone, because then we're going to get that dullness. And as we work our way down here to the bottom, it's very possible you might start to hear a little bit of dullness from some of the organs in there. It just depends on the person. Okay, good. So now we're going to auscultate, and we're going to make sure that we hear those proper sounds in there. Okay, go ahead and take a deep breath. Good. Good. Okay, good. There were no adventitious sounds. The lungs sounded clear. So I'm going to find the bottom of that spinous process again, scapula. Well, so that's my T7 to T8. I'm going to walk down 3 to T10, and I'm going to do for her chest expansion. I'm going to place both of my hands right here and have her take a deep breath, and I'm looking for my thumbs to symmetrically go apart and come back together. So go ahead and take a deep breath for me. Okay, good. If you could, lay back down for me, please. Okay, So lung sounds were clear. Everything was good. Do you practice self breast examinations?
Yes.
Okay. And do you know when do you usually do them?
In the shower.
Okay. And how often do you practice them?
Once or twice a month.
Okay. Good. Perfect. And you just do you go in like a circular motion or an up and down?
I do both.
Okay. Perfect. So now what we're going to do is we're going to take a listen to her heart sounds, and we're going to use the ape to man, which is aortic, pulmonic, Erb's point, tricuspid, and mitral. That took me a while to think of that. I don't know why. We're going to be checking to see if we hear any like heart murmurs, any like irregular beats or anything like that. So how I'm going to find this is I'm going to start at the sternum, and I'm going to come down and I'm going to find that angle of Louis, which for some reason for me is really hard to find. Okay. We're going to go over, and that's going to be our second intercostal. And we're going to start on the right hand side, and that's going to be the aortic. And I'm going to be using the bell. And we're going to go directly over, and that's going to be the pulmonic. We're going to walk down one, and I'm sorry, the aortic is right on the right substernal, and the pulmonic is on the left substernal, and then we're going to walk down one to the third intercostal left substernal. And this is Erb's point. Okay. And we're going to walk down two, so I'm going to have you lift your shirt. Walk down two to the left substernal, and this is going to be the tricuspid. And then we're going to go in the middle, mid-clavicular, and this is going to be the mitral. And this is where we would usually listen for a minute, but because of the video, we are not going to. And again, this is where I would check with the carotid artery and make sure that for every beat I'm hearing, that we're palpating it in the carotid as well. So good. So her heart sounds were normal, or not normal, but they were regular. They sounded appropriate. I didn't hear any extra noises or extra sounds, extra heartbeats in there. So I'm going to go ahead and palpate the carotid arteries. And I'm only going to do one at a time because I don't want my patient to pass out. I think it would be funny to see Olivia pass out, but we don't want to do that today. So I didn't feel any thrills. Wasn't beating a whole bunch. I'd like to say too, when she lifted her chest, I didn't see any heaves or like fluttering where the heart would be. I'm going to go ahead and auscultate the carotid arteries, and what I'm going to have her do is I'm going to have her take a deep breath in and release it and hold, and I'm going to do it with her so that way I know when she's running out of breath. Because again, although it might be funny, we don't want Olivia to pass out today. Take a deep breath, exhale, and hold. Okay, go ahead. I forgot to hold my breath. I'm not even going to lie. I didn't hear any bruits, so we're going to check the other side. Go ahead and take a deep breath. Release it. Okay, go ahead and breathe. So I didn't hear any bruits in the carotid arteries, so that's really good. So again, with the cardiovascular system, what I'm going to do is I'm going to check all of her pulses, and I also want to check her capillary refills. So I'm going to start here with the brachial. I'm going to try to find it because very difficult to find this one sometimes. So here it is on that side. You got to kind of get behind that bicep muscle. Okay. Okay, so those are a +2. They're both strong with like a +2. We're going to come down here and check this one. Okay, good. Those are strong those are +2, strong, regular. Go ahead and bend up your knees. I'm going to try to find these simultaneously, but it's very possible I won't be able to because there are some muscles in here that we have to kind of move around to get in there. So if I can't find it without using both hands, then I'll do it one right after the other. Okay, so there's that one. Okay, I'm not going to be able to find it without my second hand. So I'm going to come over here, my second hand. Okay, so they were both a +2, strong. They were in sync, pretty regular. So I'm going to check the ones here on her feet that run down this tendon, which I think is the dorsalis something. I should know it, but I'm having a brain fart because I'm nervous. Okay, so these are again a +2, and they are in sync. I'd like to note that her toes are a little bit cold, but not too bad. She does have like good color in both feet. They are symmetrical. I'm going to come up here behind the ankle here, and I'm going to try to find okay, and these ones are a +2, and again they are in sync. I'm going to test the capillary refills. She does have her toes painted, so what I'm going to do is I'm going to push on the top. And we want to make sure that that returns in about less than 3 seconds. Good. Okay, good, and she does have proper refill. Let me test your hands now. Okay. And I'd like to say that the nails are clean. They're not brittle. They don't look like they're breaking. They're a good shape and good color. They're not like yellowing or blue or anything like that, so that's good. So we're going to go with the range of motion, and I would like for you to tell me if you're having any pain with any movement or anything like that.
Okay.
And do you have any issues with any strong or like stiff joints or anything like that?
No.
And I did forget to mention, like, do you have any chest pain?
No.
Shortness of breathing?
No.
Do you wake up at night like short of breath or anything like that?
No.
Do you seem to lose breath easily with activity? Do you notice any swelling in your legs?
Sometimes.
Okay, but how often?
Just when I'm on my feet all day.
Okay. Does it usually just go away with rest?
Yeah.
Okay, sweet. So normally we're going to do it on both sides, but for the sake of the video, I'm only going to do it on one side today. So let me know if you have any issues. There's just a slight bit of cracking here, but that's not causing you any discomfort? Okay. Okay. There is nothing there. No cracking, no crepitation. Okay. So we're going to go to the leg. I'm going to have you. Any pain there?
No.
Okay. I'm going to do the foot. Okay, and the toes. Okay, good. She has full range of motion. I believe it's like a +5 or something like that. Do you have any abdominal pain?
No.
Any like bloating, gas, diarrhea?
No.
Okay, and when was your last bowel movement?
This morning.
Okay, and can you describe to me what it looked like?
It was formed and brown.
Okay.
Yeah.
Did it have like a really strong odor or anything like that?
No.
Okay, good. How are your periods?
Regular. I get
Regular?
them every month.
Okay, and are you sexually active?
Yes.
Okay, do you use protection?
I do.
Okay, and have you had a gynecology appointment lately and been tested for STDs?
A couple months ago.
Okay. All right, I would suggest continuing, especially if you're going to be sexually active. I know you use protection, but there's always a risk for infection, so I would stay up on those appointments.
Okay.
So I'm going to go ahead and text your abdomen.
Okay.
So if you could please lay down flat for me. Okay, so bring this just a little bit closer so you guys can see what I'm doing here. So I'm going to lift up your shirt, and I would like to say that the stomach is symmetrical. I don't see any bulges or anything like that. There's proper coloration for ethnicity. I do see a little bit of striae, but it's not like abnormally colored. The umbilicus is midline. So I'm going to start by auscultating. I'm going to auscultate in 2 areas in each quadrant. And I want to do that before palpating and percussing because I don't want to shake up some sounds that weren't meant to be there. So I am going to use the diaphragm. That was a good one. Okay, so vowel sounds are present times 8, times 2. I don't know, there are 2 in each quadrant, so that would be 8. So I'm going to listen for bruits in the abdominal artery and the renal arteries and the ileum. So I'm going to take my hands like this, I'm going to place it at the navel, and where each one hits is where I'm going to listen. These 2 are going to be my renal, this is going to be my abdominal. I'm going to place it here, I'm going to start at the abdominal, and I'm going to make sure that I use my bell so I can hear the bruits. Okay, I'm going to take my fingers like this again, and I'm just going to listen at these 2 points when I place it at the umbilicus. Okay, good. Oh, Jesus. Good. I didn't hear any bruits or anything like that. Sounded good and strong. So now I'm going to go ahead and I'm going to percuss around, starting down here in the right lower quadrant, and make sure that there's no tenderness or nodules or anything like that before I start palpating. So let me know if you have any. I'm listening for that resonant sound, but if she's got a bowel movement in there, could sound a little bit dull. So I want to be aware of that. And also, if I'm coming over any type of organs that maybe are inflamed, you could get that with that too. So any pain or tenderness there?
No.
So I'm going to go with a light palpation. I'm going to go to 1 to 2 centimeters into the skin, and I want you to, why are you looking at me like that?